The oxygen revolution is on. Welcome to the Vibrant You Show, where we discuss the advantages of cutting-edge therapies like hyperbaric oxygen therapy, light therapy, microcirculation, and more. Inside the chamber, it's a nap with benefits. Now, your host for the Vibrant You Show, the Oxygen and Light Lady, Stephanie Parrish.
Good morning and welcome to the show. We're so happy to have everybody here on this beautiful, beautiful day here in southern Utah in St. George. I have got a guest with me today, Mr. Craig LeDuc. He is a strategic partner with Schoolie Mitchell. I'm going to introduce him to you in just a little bit. You're going to be blown away with the knowledge this man has. I just love him to death, and whoa, every time we get together, my mind is blown. But I just wanted to talk a little bit about what we're going to discuss today. So we're going to talk about healthcare and the money that we spend to maintain our healthcare. We all know how that works, right? We appreciate our doctors and our surgeons, and those of you that have been listening to my other shows have known my son just had surgery. There's certain things that we just can't do, and so I am very, very grateful for our doctors and our surgeons, our pharmacists, any other medical professionals that are out there. We need you, we love you, we appreciate you, and we're especially grateful for those that are open to alternative health care and are willing to refer over to us, because what we get to do is life-changing as well. We definitely appreciate where you fit in this whole world of health care and where we're at. Healthcare is changing in America. It's becoming a totally different world out there with alternative medicine. It's fast emerging as the future of healthcare, and we get to be part of that. We just had the opportunity to attend the A4M Health and Wellness Show down in Vegas a few months ago with our Avicen, our microcirculation machine. And while we were there, we spent 3 days at a booth showing people, teaching people, educating them. And we realized that over 80% of the people that came to our booth were actually doctors, different kinds of doctors, different type of modalities, but a lot of people in the medical profession. And they were there to learn what we do. It's because the alternative health therapy these days is changing. And if you're going to ignore that, you're going to be kind of left in the dust. So we are noticing a huge trend, and we are so, so grateful to be part of this. In 2018, Americans spent over $30 billion, that's billion with a B, on alternative therapies. And they're projecting to spend more than $150 billion by 2025. And as the research money that's going into development for alternative therapies, technologies, it's all going to soon surpass the medical research. This has been told to us. We've been studying this, researching this for a while, and this is exactly what we're seeing happening, and how grateful we are to be part of this world. And why is this happening? And what's behind the trend? Simply, alternative therapies work, and they have very few side effects. And in the whole scheme of things, they're a little bit cheaper, actually a lot cheaper than the real medical world that's out there. One of the most exciting alternative healthcare therapies is hyperbaric oxygen therapy. It's becoming more known, well known all around the world, and we're so excited about that. Other exciting therapies include the PBMT light therapy. A lot of you have heard me talk about that. The Avicen thermal therapy, the PEMF therapy, or the Beamer, or the QRS. And neurofeedback. There's massive amounts of scientific research behind all of these therapies. And I also always get asked, is there research behind them? Well, absolutely there's research behind them. If there wasn't, we wouldn't be using them. So there is amazing research behind them, especially with hyperbaric right now. There's so much out there, and I get the privilege of working with some of the top doctors in the world, and they're constantly keeping us up to date on what's happening in the hyperbaric world, what's happening in the different pressures, the different kinds of chambers. It's really been fascinating. So rest assured that they do work. We're seeing it every single day. Every day we get to see miracles come out of our clinic. At Vibrant You, we really are blessed to be able to use these modalities that we have been given. We see people getting well even when their doctors have given up on them. And this is just sometimes because of knowledge, because of being able to know what the alternatives are. The other day, we saw a person release a a statement out of South Korea about the success that they're having treating the coronavirus with hyperbaric oxygen and light therapy. Actually, just the hyperbaric therapy. I was jumping all over the place when I read this. They were saying that they had complete recovery from a number of people in South Korea with the coronavirus using hyperbaric oxygen therapy. Is that so cool? Anyway, now you might be wondering, are these therapies covered by health insurance? People, that's almost always the first question. And the short answer is no. Sometimes the Avicen thermotherapy can be covered in specific areas if it's placed under dry heat therapy. But for right now, we've got lobbyists and legislators working on trying to get it covered. But as of right now, no, it is not. So we try to keep our prices low. We try to keep everything reasonable so that people that are searching for alternative health care can get it. So it's definitely worth hearing about it. So stay tuned and listen and see what we have to offer here and what your alternatives are. That's the whole idea here behind this podcast, is for education. We want to educate people about what the alternatives are and what you can do with it and why they work. So with that, I have got, again, like I said, Mr. Craig LeDuc with us. He's our guest today. He specializes in helping businesses and individuals to reduce their cost and leverage their expenditures in some really, really clever ways. It's, like I said, it's fascinating to listen to him, how he can do things and what he's doing for so many people. So Craig's with Schooley Mitchell, and he has a wealth of knowledge and experience in controlling the cost of health care. And we were just kind of chit-chatting a few weeks ago, and it's like, oh my gosh, I need to have Craig on my show. So we asked him, and he graciously agreed to come on the show with us and share. We have this much time for a vast bit of his knowledge. I'm sure that if you would like to know more, we'll be sure to give you his contact information. So with that, I'm going to turn some time over to Craig, and he's going to tell us what he does.
Well, okay, so basically you mentioned that we help businesses with their costs. Basically, we go in and restructure the relationships they have with their service providers so that they're able to spend less, which allows them to put that money, that time and those resources back into growing their business, helping their clients, helping their employees. So you and I were talking about that, but we were talking about it in terms of this whole, well, okay, you deal with cost dynamics all the time. How does that apply to what we do specifically? And I'm glad you mentioned it, the insurance and whatnot. Now, without taking shots at anyone, though I'm probably kind of doing that, the reality is that most of what we think of in terms of healthcare, i.e. the hospitals and whatnot, it's all intervention. It's mostly reactive as opposed to proactive.
Exactly.
Now, having said that, I'm the first one because I'm constantly driving to see clients or sitting down over, lunches that are probably bigger calorie than I need them to be, and one thing or another.
We don't talk about that. They're business.
But lifestyles being what lifestyles are, it's very difficult to eat right, to exercise right, to do all of these things that we need to do. And our bodies are paying the price for that. Exactly. So, how does that happen? Well, what we think of as traditional healthcare really doesn't address that, and insurance doesn't cover a great deal of the preventative measures unless, of course, you're talking a once-a-year health care checkup, and even then all they're saying is, okay, you broke a little, or oops, you broke a lot. But if 80%, and I think that's the figure I've heard, is something like 80% of all healthcare dollars are spent on essentially what amounts to lifestyle injuries or lifestyle illnesses and so forth. So my wife is a health coach, so it's one of the reasons, or at least used to be, and it's one of the reasons that I tie back into this system. And she spent a great deal of time talking with clients about nutrition. And the company at the time that she was working with had the ability to sublimate fruits and veggies into a situation where basically you could get 10 servings a day. Now, logically, who's going to argue that getting more fruits and vegetables with all of their antioxidant powers isn't going to make your system function better? Because it's how you're designed to work.
Right.
So as we apply that then to hyperbaric and we apply it to Avicen, it makes sense that if blood flow is about transporting oxygen and nutrients to cells and then picking up the wastes and the carbon dioxide and getting that back out, if we can do something in spite of our bad habits, in spite of our lifestyles, that allows our system to operate effectively, doesn't it make sense that we're healthier? Isn't it just logical that our systems aren't going to break down as quickly, if at all? If, in fact, we're able to deliver more antioxidants to our systems, whether that's endocrine systems, circulatory, whatever it might be, doesn't it make sense then that it reduces the risk of cancers and all of these other things? Now, I know that, you can't make claims in that respect, but ideally, if I'm getting more oxygen, my systems repair better. If my circulation is up, my systems are getting more of what they need. In other words, what we're talking about is not a reactive technology, but a proactive technology.
So preventative as much, right?
Exactly. But, oh, geez, how do I pay for that if insurance isn't going to do it? As a society, or at least as an American society, we've become so conditioned on this idea that if insurance doesn't pay for it, we can't do it.
Exactly.
Now, think of this analogy for a minute. We buy extended warranties on our cars, right?
Exactly.
Okay, now whether it's 100,000 miles, 150,000 miles, we're essentially saying, when it's broke, you promise to fix it. Do we quit doing oil changes?
Better not.
Exactly. Do we quit doing transmission changes or fluid changes or whatever, putting new tires on it or whatever it might be? So we understand that even though there's a warranty there in case something breaks, we absolutely need to be doing daily, weekly, monthly things that will make it more efficient. A car is just a car. At the end of the day, it's a $30,000, $40,000 expense, and if it's broke, it's not the end of our lives.
Right.
Our bodies are just a tad different.
Yeah, it is the end of our lives.
Indeed. And here's the other thing. Well, how do I pay for it if insurance doesn't? Let's think for a minute about what insurance does. And even if you're on a Cadillac plan, there's still a deductible, and the deductibles are getting higher because businesses, just like the ones that I work with, see the rise in medical care, and they're trying to cover it for their employees, or at least a portion of it for their employees.
Right.
So they're having to raise the deductibles so that they can keep the insurance affordable. So and we're demanding that more things be covered, more reactive things be covered,
Exactly.
which then in turn drives these other numbers. So what happens is, independent of your insurance, you have copays, you have the 80-20s or the 90-10s or the 70-30s or whatever they may be. So it's not as if you don't have out-of-pocket expenses when things go wrong.
Exactly.
Now, I don't know what the cost to treat a cancer is. Fortunately, my family's not had to deal with that.
I just had a client that said they're over $200,000.
Over $200,000.
Yes. And
So,
now they came to me because it didn't work.
Exactly. And this is money that they've invested after something broke.
Exactly.
And after their insurance. So it's really the oil change discussion. If I apply a smaller amount of money on a more consistent basis, not only do I not have the breakdown, which is huge,
Yep.
but it's also less expensive than all of the supplemental costs, if you will, that are above and beyond what insurance covers. So the idea that I do or don't have insurance is really a non-starter question.
Exactly. Irrelevant to what we're doing for your body.
Now, here's another one, and we're talking to businesses more about this all the time, is if you knew that the insurance you were covering for your employees really needed to be for trauma, i.e. the things that we can't control. I mean, you break a leg, you break a leg.
Yeah. Got to get it set.
But if it covered that, and it covered really the catastrophic stuff, so I could afford to take my deductibles way up, and now I'm going to use alternative things like, wellness benefits or cash pay type stuff on the smaller stuff, or I'm now going to invest in nutrition, or I'm going to invest in things like Avicin and hyperbaric and the Beamer and all of these other things that actually just help our system function better in spite of where we're at in terms of our lifestyle. Again, now I could provide my employees full coverage, but I could also invest in this other thing either for them or partially pay for them something that ultimately is going to reduce my premiums as an employer, and it's going to increase their health, which keeps them on the job more.
I love that thought that you're going on right there, because really, if we could get more insurance companies to help or employers to help with the preventative, like you're saying, there won't be as many catastrophic, right? There's not going to be, the body, when it's given the right tools, is going to be able to function better. That's just logic. That's just how it works, right? With nutrition, oxygen, light, microcirculation, their body is just not going to break down like you said.
Exactly. And here's the trick. And you know, I'm right there in terms of the life. I've kind of already, I mean, I'm 60, I'm about 50 pounds overweight. I know there are things I have to do.
Right.
But sometimes our belief, well, I've tried this before and this doesn't work. I've done that before and that doesn't work. Well, what I used to do at 40 doesn't work at 60. Okay. After all my excuses are done, I'm still at risk. But when I use technologies that allow my systems to function better, metabolism rates go up. I feel better. Now the belief starts kicking in. And most people understand that it's not a lack of knowledge that keeps us from doing the right things. It's the motivation. And most of our motivation doesn't come because at the end of the day, we either don't believe it can work for us or we don't believe we'll work it. Well, if you're giving your body the things that allow you to now start seeing incremental changes and you can build on those, then maybe it motivates you to do other things as well that create other opportunities for you.
Absolutely. You always, when you feel better, I get clients, I've got a cancer in the client in there right now that's had cancer for a long time. This is her third round of cancer. Ugh. She's got lymphoma. And when she came into us, she was barely functioning, barely walking. She could barely use her walker, and she was very slow and very hunched over and very gray skin tone and just not looking well at all, obviously. She was told there's nothing else that can be done for her, that she's just going to have to be comfortable and pass through this life at this point in time. She wasn't willing to take that as an answer. So she's come in with us, and it's been just a blessing working with her. She's now done her 40 sessions. She just finished them. She realizes she needs more, so she just added another 40. Plus, she purchased one of the Avicen machines, and she is going gung-ho with this. And it's been so fun to watch her. She came in the other day, and she's standing up tall, and she's holding her shoulders back, and she had just got done walking 4 times around our building. You've been to our building. It's a pretty big
yes.
building. Right? 4 times around the building. She walked around that building. And when she started with us, she couldn't get from her car to our office door. And she was telling me, she says, I just feel really good. And I'm like, oh, this is exactly what we want to have happen, right? She goes in a couple weeks to do her cancer testing to see where it's at. She says, if anything, Steph, I just feel good. She goes, I feel like it's doing something. I feel like something's moving because obviously I'm able to stand up. And she looked around. She realized she didn't even have her walker with her. She's like,
imagine
I didn't bring that with me.
Imagine how cool that is. I mean, you know, certainly we talked about the preventive side, but okay, I've got it. What do I do? We all know the horror stories of
Yes.
treatment. And we all know the risks that it's coming back, or even when I'm done, I'm not feeling quite the way I used to before. And I think it's probably one of the greatest fears, at least that I have in terms of getting old, is it's one thing to say I can live until 80, 85, 90, whatever it might be. It's another to say I'm going to enjoy living that long.
So true.
You know, so many of us, I mean, the term that my wife used to use as a health coach all the time is when you take better care of yourself, those later years, you postpone, if you will, and you shorten the time frame on, if you will, the miserable ones. When ultimately you're going, I mean, let's face it, we don't live forever.
Right.
And so at some point our body will break down. But that time span between breakdown and then transitioning, if you will, is a lot less traumatic. It's a lot less whatever when we're healthy, because we extend quality of life, not just quantity of life.
Right. I'm glad you said that, because that is our motto, right? Quality of life.
Oh, is it? Hey,
you choose.
I did it, right?
You did it. You choose, we support. And I did that mainly because quality of life is so vital, right? And everybody has different levels of quality of life, but most of the people that come into me, they just are really, they've either been given a death date, or they've been told that they'll never walk again or talk again or see again, or they've been told that their bodies aren't going to function, that they're going to have all these surgeries and all these medications. And I mean, it's just, it's crazy, some of the things that my clients tell me when they come in. And what I chose as my mantra is quality of life. You choose, we support. And we do have a number of people that choose not to do what we do, that choose not, they'll come in and listen and thank you, and they'll go off and do something else, or they'll just go die. Some of them have done that. And it's like, try. You know, I can't force somebody to try. I can't force somebody to come in with the right attitude and say, you know what, you're going to kick this. This is going to be happening for you if you have the right attitude. So we want people to know that we're going to support them. That was really a hard thing for me to decide for a number of years when I first started. I'm going on my 8th year doing this. It's been a long time, and I've seen amazing things happen, and I've seen some very sad things happen. And it's like, try. Let's see what your body can do, but if they choose not to, I have to just step away and go, okay, you choose.
But the beauty of the choice you're talking about is now I have options open to me I didn't have before. I mean, I remember having this conversation with my wife and saying, you know what, if we get to that point, I want to just live as well as I can and then be done. But not only does this provide new hope, but that option is still open to me. But now maybe I can do it more comfortably. Right. Or I can say, all right, I'm going to go the full range of treatment. But now I can do this as well. And at worst, it's got to improve my odds of getting better. I mean, studies, no studies, logic, no logic, call it what you will. If there is an alternative therapy that can even work in tandem with what we would consider to be traditional medicine, and I'm really after everything, why wouldn't I want to improve my odds?
Absolutely. People that are in the middle of these horrible cancer treatments or ruptured discs or bulging discs or going into surgeries or whatever. We have so many people that say the doctors have told us, and I just went through this with my son, that the surgery went so much better because he was able to do the microcirculation before and get the blood vessels moving and get the blood flow going and the tissues were looking better. Why not? Mm-hmm. Why would you not want to do that?
Well, and you mentioned bulging discs. I mean, my mindset, I'm thinking of staving off all the disasters, right?
Exactly.
But it is the little things. I came in for a treatment and the Avicin.
Right.
I love the Avicin. Now, for me, sometimes it's just better to be lucky than good. My blood work is good in spite of all of the stupid things I do to my body and so forth. But it doesn't mean I don't have these nagging aches and pains and one thing or another, right?
Dang age.
So between the Avicin and the hyperbaric, I've noticed that the circulation going into my lower extremities is better than it used to be. I mean, and maybe that's not a huge thing, but I'll bet it is.
Absolutely.
At the very least, I function better. The onset of old age isn't quite these. I mean, we live in St. George.
I know.
There is so much to do in so many ways if we feel like we can do it.
Exactly.
What's it worth to feel like you could jump on a bicycle again?
Oh, absolutely.
Or in my case, I'm lazy to get on a motorcycle, to take a walk, to, do whatever.
Yeah.
To have a lifestyle that's maybe as active as the one I enjoyed 5 years ago or 10 years ago. Or the idea that 80 could feel like 65 or 70. Again, I don't want to make miracle claims. That's your job. No.
I try not to do that either.
Exactly. And
I just tell the stories.
And I don't think we have to. I think the idea is, gosh, if our bodies functioned at 70 the way they functioned at 60 or 60 at 50 and so forth, again, isn't it logical that if I'm giving my body better tools, it's going to feel better?
Absolutely.
And at the end of the day, and probably at about the end of this podcast, isn't what we're saying is I just want to feel better.
That's what most people tell me. Just want to feel better. And we don't. I was going to share a story, so I'll have to save that for later. But that's the whole idea, right? They just want to feel better. And when our clients come in and they go through the whole process with us, their bodies would go through this crazy up and down, because when your body's repairing, it can be painful, right? And they can go through. And I had one of my cancer clients the other day. He said, "Oh, you told me I was going to hit a wall. Oh man, I hit that wall." He goes, "I am feeling crappy." Sorry saying that on the air. But he was just like, I said, "You just keep working it through. You keep coming back." And he came back the next day and he goes, "It's exactly what you said. I'm feeling better than I have felt in years." I said, "Because you just broke through one of those barriers. That's what's happening. Your body just broke through one of those barriers. It's opened up the tissues and it's getting the blood flow and it's letting things move the way that it's supposed to."
And it opened up the possibilities.
It opened up the possibilities, and he's just been so excited and thrilled about that. And again, he's still got some ups and downs to go through, but everybody does, and that's why we do what we do. Just keep coming, keep pushing. If you can get in, as we've been talking about preventative, You don't have to go through that stuff, not to that detail that a lot of my clients are going through. So let's put the right tools in your body, which is light, oxygen, nutrition, your microcirculation, and see what it can do. So we're winding down with time. I told you this goes so fast. It's like, I want to talk more, but we've only got a few more seconds. So what's your final closing statement that you'd like to say?
I think I said it. Let's age gracefully. Let's age actively. Let's enjoy whatever it is we have, and let's use the tools we have to do it.
Beautiful. Thank you so much. Again, this is Stephanie, the Oxygen and Light Lady with Vibrant You Hyperbaric Oxygen and Light Center. Have a great day.
This has been the Vibrant You Show with the Oxygen and Light Lady, Stephanie Parrish. For more information about hyperbaric oxygen therapy, PBMT light therapy, Avicen microcirculation, neurofeedback, and other modalities, go to vibrantuutah.com. Until next time, this has been the Vibrant You Show with the Oxygen and Light Lady, Stephanie Parrish. And remember, the oxygen revolution is on.